Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today, we have a special sponsored episode. I'm joined by Ernie Wallerstein. He's the CEO of Mental Health Technologies, or MHT. MHT is a cloud based platform that enables healthcare clinicians to identify patients that may be suffering from undiagnosed or inadequately treated mental health and substance abuse disorders. Find out more at mhtech.com. That's mhtech.com. As a primary care physician, I routinely see how behavioral health conditions like anxiety and depression affect more and more patients' lives. This is especially true as we emerge from the pandemic. The United States Preventive Services Task Force has recently recommended screening all adults for anxiety. But given our time constraints and dozens of other screening tests and questions that we have to squeeze into a 15-minute office visit, I'm looking forward to hearing about anything that can help address our behavioral health crisis. Ernie, welcome to the show.
Kevin, thanks a lot for having me and excited for our conversation.
So, first question is just to briefly share your story and journey to where you are today.
So appreciate that. So I'm definitely coming at this from a technology standpoint. I've been in software, cloud computing my whole career, 30 plus years. And in my job before starting MHT, founding MHT with my co-founder, Bill Leonard, was running a cloud computing company here in North America. And saw an opportunity for technology to address a major issue. So, technology is not going to accurately diagnose or cure an individual, but it can provide some tools where healthcare professionals can do a better job of tackling this increasingly large chasm that is the challenge of mental health and substance abuse in the US and in the entire world. So, that led me to, think about how to do something maybe more important in my life and also take advantage of some of my experiences and address something that touches all of us. And, like many of your listeners here, my family's been touched by behavioral health issues. The youngest is 6. I have a son with ADHD. I have a mother with severe dementia. And, as you move on in your career, you want to move a little bit higher in that Maslow hierarchy and start doing a little self-actualization and helping out people. So that's what got us to start MHT, and excited to share more about it with you on this podcast.
So, tell us about the journey of MHT. How's it grown?
So, MHT started out as an idea. Met with a psychiatrist who had this great idea, but he was looking at it very clinically, didn't really understand or know how to get the technology to help. And in meeting with him, I was immediately drawn to the opportunity for technology like MHT to help behavioral health professionals as well as family practice doctors to not only identify behavioral health issues, but also stratify the level of need. As we've matured over time, we've learned that it's not just about who needs help, but what level of help. There's only X amount of finite resources at every level. I call them off ramps,
Yeah.
and you want the last off ramp to be a visit to the ER. So how do we get people help before they get to that level, right? So ER, psychiatrist, psychologist, their doctor, are there self-help tools? Are there things they can be doing themselves? And so help stratify it. From a journey standpoint, Kevin, we started focusing on behavioral health because large behavioral health practices, they were just seeing so many patients where the medical director really didn't know what was happening with the patient population anymore. You're running a large practice, everything became anecdotal. Getting the notes out of an EMR or EHR is really hard because everybody has their own writing styles. So it was hard for them to have statistics or data that let them know, is their patient population getting better? Are their providers getting better? How do you put best practices in place? If this psychologist is great with depression and that nurse practitioner is really good with anxiety, how do you take the best of both and share that across your entire provider population to provide a better level of healthcare? And that's where we started. And then we've expanded over the just under 4 years we've been doing this to realize that primary care is the tip of the arrow. That's where it starts.
Mhm.
The majority of behavioral health drugs are prescribed at the primary care level. You'd know that really well from your own experience. How do we get them to have a better understanding of where their patients are? And do they need to maybe refer those patients out? So we've really focused now on the relationship between primary care and behavioral health, where primary care screens and we automate electronically the referral process to a behavioral health practice that might be able to handle those patients with more acute symptoms.
Now, coming from that tech side and seeing this primary care behavioral health intersection, has there anything that surprised you about that intersection coming from that tech side?
Yeah, maybe from the human side, I'm surprised by how many people are scared about this. Even providers, I've talked to cardiologists that are like, I'm here trying to solve this problem. I'm not in a position, I don't have the time to go deal with the behavioral health issues, even though it's know it's a contributing factor. And that was really surprising, right? And I understood though, they're overwhelmed. It's an overwhelming issue and it's just growing, right? The stats are amazing. 1 in 5 adults, it's now moving its way down to 11-year-olds. The suicide rates are going up. So that was a surprise. And the other realization I've come to, Kevin, is technology is a contributing factor to the mental health issue that we're facing, right? Especially kids, they're inundated with negative information because of the
Hmm.
world we live in. I always like to give this little story. When I was a kid, if there was a bully, you had two choices, you punched or ran. Now bullies are 24/7. They're around the world. It's nonstop. So, I've just come to that realization where, technology has been a bit of a cause of it, but technology properly applied, a technology like MHT is a massive tool to the healthcare industry. And moving on to the corporate world, right? Like companies are now taking on ESG programs, environmental and social governance. When a disgruntled employee, not disgruntled is the wrong word, an employee suffering is non-productive. They're looking for help. And corporations need to embrace this as well. Technology can be a big part of safely identifying people who need help and stratifying the level of help they might need.
So what you said about addressing behavioral health from a primary care standpoint certainly resonates with me. And just like you said, it's not just with the cardiologist. I think all of us, we are just so pressed for time. So a lot of us just could use all the tools that we can get when it comes to addressing this issue. So how do you see technology like MHT? How do you see that helping solve the behavioral health crisis?
So solving is a big word, but contributing to the solution, if you will, right? So a couple of points you made. You have 15 minutes. So with technology, software like ours, so our software allows patients at their own pace on a cell phone, on a computer, to take some mental health screenings or actually, substance abuse screenings. And these are all recognized by the American Psychological Association. They're DSM-4, DSM-5 compliant, and your audience knows what that means. And do it ahead of the visit, right? So let's just paint the picture. I'm coming to see you a day before I come in. I might take a depression screen. I might take an anxiety screen, maybe a social determinants of health screen, which is becoming a big deal, right? Are people comfortable in their home and do they have the proper living environment? So I take those screens ahead of coming in. Those results are processed. And if there is some type of abnormal score there or something to be alerted, you as the provider would know that in the patient record that, hey, Ernie scored really high for depression. Ernie had suicidal ideation. Ernie's doesn't really have a good living situation. So instead of you having to deduce those things, right? If you have to ask me those questions, that's a 5-minute transaction and
Mhm.
you have 5 other patients waiting. That alert's already there. Your MA already knows, your PA already knows. There's people who can start dealing with that up front, and you're starting to stratify who really needs you as the doctor's time, who might be able to be handled by another resource. And so technology is allowing us to identify the people up front. It's allowing us to help decide what level of care they have, and that makes the doctor's time way more efficient. I even talked to a physical therapist, and in this case, she told me that 30% of her time is spent talking to people about their
Yeah.
behavioral health issues, either during therapy or before. So in that situation, if we're able to identify those people up front, let her know she can prepare for that. Maybe someone else in the office can talk to her versus her. Now, that just exacerbates or becomes even more important when you get to the doctor level. Their time is even less available. So, how do we help you provide a better level of care in a more efficient manner? And that's where MHT comes in.
So let's talk about the workflow, both from the patient standpoint and the clinician standpoint. So let's start with the patient standpoint first. How would they get started with your platform?
Sure. So, we're not business to consumer. We're a business to business. Our audience are healthcare providers and or corporations who are starting to put ESG programs in place. But for your audience, let's focus on the healthcare providers. We're integrated to the EMR, the electronic
Mhm.
medical record system, right? And whenever an appointment is created, based on the rules you tell us, Kevin, right? So you're the medical director for your practice. You say, these patients in these scenarios, I want them to get these screens. So that's automated. So I have an appointment 1 day or 2 days before my appointment. I receive an email or a text message telling me, hey, my trusted advisor, my family doctor, my behavioral health doctor or nurse or PA or social worker is saying, hey, take this screen. I do that because I know it's coming from a trusted source. And those results then are immediately written into the EMR. So this is an important part of our technology, and I think it's important for the healthcare industry. We're not teaching people another platform. The technology industry has enough to deal with their EMR and dealing with billing issues with the insurance providers, right? We're not trying to teach them a whole nother platform. We integrate seamlessly into your existing workflow. So to walk through it again, I, as a patient, set an appointment. I would automatically receive, based on the business rules set by that practice, certain screening tests. I respond to those, and those results are written into the EMR. If there is an event that requires some type of alerting, we both highlight that in the EMR, and we, being MHT, can send a text message or email to the appropriate resource. An example of that would be maybe somebody with suicidal ideation. Does someone need to call that person now? Another example of that would be someone's in behavioral health. They're still really scoring high for depression. They've tried a whole bunch of different drugs. They've been at this for 10 years. We'll ask them a question. Are they interested in learning about a more advanced treatment like transcranial magnetic stimulation or Spravato? When they say yes, that allows a different department in that healthcare provider to engage with that patient and try to help get that patient a better journey to wellness.
So, what are the different ways that patient can fill out the questionnaire?
Sure. The most popular way is cell phone, right?
Hmm.
So we'll send a text message. People are comfortable on their cell phone. I'll tell you a quick anecdotal story here in a second. And or they can do emails.
Hmm.
If those two methods don't work, either because the person hasn't gotten to it or maybe they're not comfortable with those devices, they also can take it on a tablet at the doctor's office.
Okay.
Any one of those mediums is available, right? They can increase their font size. It's language specific, right? So especially in the US, you have a large English speaking, a large Spanish speaking. As long as the EMR tells us what their primary language is, we'll give it to the test in that language. So they take it, they can take their time, they're comfortable with it. So the anecdote I was going to share with you is someone said, well, how's that going to work for seniors? Right? There's a large Medicare
Yeah.
population in the US. And the person ran a large practice that dealt with lots of seniors, right? They had over 10,000 senior lives under their care on their practice. And, anecdotally, not anecdotally, he said, hey, I'm assuming 20% of my patients would fill this out. And this is the beauty of technology. Data is a big part of this. I was able to look at 44% of all seniors filled out these forms on the first attempt last year from us, right? So I knew that almost a 50% hit rate of people would do it. Like, I have a 92-year-old dad. My dad's on his computer every day,
Hmm.
right? Because that's how he communicates with the world. He can't get around anymore. So he's on Facebook all the time. He's accepting a lot of the wrong ads and clicking a lot of buttons, which causes me time to fix it. But, I think our senior population is more comfortable with technology than we give them credit for. And these assessments, if you will, that are delivered by MHT, allows them to do it at their pace, larger font, and the way they want to, right? The other key part here, as you ask about the patient experience, they're going to be more honest with an inanimate object than talking to another human being about their state of depression or anxiety or alcoholism, because they're not being judged. Like, I think as people, when people ask us questions, we feel like we're being judged, where if we really want help and we're talking to an inanimate object like our email or our
Hmm.
cell phone, we're going to answer honestly. And there's plenty of statistics online that back that up. So the user experience has been fantastic, right? So we send it out to the patient a day or two before. We'll send them a reminder. And if they didn't take it when they walk in, we let that front desk staff know that, hey, this patient has some pending assessments to be filled out. From a medical professional standpoint, it looks like a lab, right? It's just, this is a mental health assessment versus a urine sample or a blood test.
So, you mentioned there's a menu of assessments that we could send to patients. What are some of the different things that we could screen for?
Sure. The big ones are depression, anxiety, because of how many people that affects, right? But there's, opioid addiction, ADHD, there's bipolar, there's postpartum depression. That's a big one, right? Like, statistically, postpartum depression, the stats are amazing. It's like 1 in 5 women suffer from postpartum depression, right, after childbirth, 15% get help. That's mind-boggling, right? So,
Mhm.
like, if you're a women's health clinic, use these screens. Let's get these people help, right? That's better for them. They have a healthier life. It's better for their family. It's certainly better for the child, and most of them want help. So there's obviously different levels of depression. We have about 45 different indications we test for, Kevin, and we're always adding more based on the requirements or requests from our customers. We have a couple pain clinics using our system, right? So they're worried about opioid pain scales. They're worried about drug use. So those are just, a sampling of them. But again, there's about 45 different ones and always adding more.
So let's say I'm an MHT client. I walk into my office 8 o'clock in the morning, load up my EHR. What could I see?
Sure. So, and it's important that works, right? So we at MHT, we're going to work within your current workflow. There are some providers who do everything within the patient chart. There are other providers who do it from their dashboard. So we're writing to a couple different spots. We write results to the labs, your general lab tab, as a provider. So we identify the patient and the provider when we provide information to the EMR. So in your dashboard, you'd see, hey, I have some labs pending for today, and you could see a quick dashboard. It says, okay, here's these 12 MHT results for your 6 patients. But when you go into the patient chart as well, in the general chart, it says, hey, here's a summary of the tests that your patient took. They took a PH29, they took a GAD7, and they took a social determinants of health, right? And I'm just using those as examples because in primary care, those are the 3 big ones,
All right.
right? That, and then the DAST, which is a drug screen, and the audit, which is for alcohol. And those are big in primary care because of the amount of people suffering from it, but also it's within CMS guidelines. CMS actually recommends that healthcare professionals, as part of annual screenings, do both mental health and drug and alcohol screens for their Medicare patients. So it's in your dashboard. It's also in that patient record that I took my test. The actual PDF with every answer I want's there too. The average doctor's not going to that, right, Kevin?
Yeah.
They're too busy. But if we've given them an alert saying, hey, there's something to look at here, they might look at it. The other big thing we'll do too is we'll chart and graph patients' results over time. So now imagine that patient moved from primary care to behavioral health. Now we're not just tracking who needed help, we're tracking efficacy of treatment. Over the last year, this patient's been on that drug or under this treatment. From their own objective opinion, are they getting better? So we can graph that, right? I can graph the patient's depression scores. You can maybe see a point of inflection. Did something change in treatment? And all that's visual. And it's an indicator for the provider or their staff to take a deeper dive because there's something there that doesn't look right, or hey, things look great, let's move on, which is also very important.
So tell us a story or a case study, just so we can see these concepts in action. Tell us a story where MHT technology has moved the needle.
So, give you a couple. I'll give you one from a behavioral health perspective. Was working with a large behavioral health practice and sat down with their medical director. And what we did is they were a very large practice. They had over 100 providers, right? So it's hard to look at everything. We said, okay, we're going to pick a couple of different providers and look at their patients and deep dive. The medical director here was just this brilliant pharmacology person when it came to behavioral health. And we were able to look at the charts of patients and just see that their test scores were not moving, nowhere off the dial. That medical director then, right, with 100 different providers, was able to go in and look at 5 or 6 example cases based on the stats I was providing him and dive into the pharmacology, what drugs were being administered, and then sit down and review that information with their provider, with a psychologist, psychiatrist, nurse practitioner, and say, hey, look, this isn't working. Have we tried this? Now, over a 6-month period, right? Over a 6-month period, he was able to hit about 18 or 20 patients, but more importantly, he was able to talk to about 12 different providers and give them other ideas of how to improve their patients' care. Those providers are touching hundreds of patients. So this is a way to really raise the level of quality using data to say, this is where, as a medical director, I need to dive in, not just for that one patient, but for all the patients that come after. So there was one example in the behavioral health world. Anecdotally, in a primary care standpoint, we deal with a primary care provider in Florida, And they knew that they were going to have a significant population of people with behavioral health issues. And
Mhm.
that provider, the owner of the practice, had been really thinking about, should I bring in a PsyD, psychologist, one or two, to provide a higher level of care for my patients because I know they need it. And leveraging our technology, we were able to do a couple things. A, we were able to automatically identify patients. So our technology allows patients to be screened, but based on their test score, it asks them, would they like a higher level of care? So when they said yes, we basically created an internal referral process to their own PsyD. That PsyD was overwhelmed very quickly, right? There's a lot of people. You go see the doctor.
Yeah.
I mean, statistically, there were 900 million doctor visits last year. We know 20% of all people suffer from behavioral health issues. We also know that 50% go untreated or undiagnosed. That means 90 million times last year, someone saw the doc who needed help and didn't get any. So using that stat, so this PsyD got overwhelmed quickly. Because of our technology, we were able to not only refer patients to their PsyD, but create an overflow to one of our behavioral health partners. So now this practice, within a matter of 3 months, went just from a primary care to now offering behavioral health services to their patients, and could do it in a way that was both cost effective for them and didn't overwhelm the practice.
Now, is the service covered by private insurers as well as Medicare and Medicaid?
Yeah. So, I didn't share my biggest surprise when you asked me. I was surprised, as an outsider in tech, you learn a lot about the insurance industry and you hear
Yeah.
stuff. But when you dive into healthcare, you learn a lot more. So it is. So, a lot of the commercial insurers the initial basis is based on what CMS policies are. So yes, these tests, both in primary care and in behavioral health, are covered by insurance. The only one where it deviates on a per state basis is Medicaid, but Medicare pays for it consistently, and all the commercial providers pay for it consistently. And Kevin, this is somewhat of a presumptive thing, but let's call it an educated guess, hypothesis, if you will. That's only going to get better, right? It's only going to get better because of how expensive behavioral health is if it's untreated, right? The last thing any insurance company wants, be it a pay for service or, a risk-based contract or a capitated contract. The thing that breaks all the models is visits to the ER room, right?
Yep.
If they could be avoided. So I do believe the insurance industry is starting to get a little bit more in tune with that. They've always been scared of behavioral health, right? There's no x-ray, there's no MRI, someone's opinion. And in the end, I actually believe the data we're accumulating is going to be invaluable to insurance companies because that allows their actuaries to actually figure out what's working, not working, and what the cost of care is. And, depending on what camp you're in here, right? The world is either moving to more social medicine or more of capitated. The insurance industry doesn't make it hard on docs. I've definitely learned that, Kevin. But screening up front, identifying earlier, leading people to off ramps that progress self-help, you know, self-help, online help, then maybe different levels of professionals before you get to that ER, before you get to that specialist. I mean, that just benefits everybody, benefits the patient, benefits our overwhelmed healthcare industry, and in the end is also going to benefit our insurance industry.
What are some of your biggest challenges when it comes to positioning MHT with potential customers?
So, I think if I talk to primary care, typically has four concerns, right?
Yeah.
So one is, does this make clinical sense for my practice? Let's just say that's the easiest one to overcome. The average doctor, nurse, PA, they're all good people. They're trying to help people. And they know behavioral health is a big part of why someone's sick or as a result of being sick. Then it has to make financial sense. Is it reimbursed? Private practice, especially, continues to get squeezed, right? It's expensive to run a healthcare practice and the margins are low. I was really surprised by that, what the margin in primary care is, right? I thought it would be some big number. It's like 6 to 8%.
Hmm.
So they need to know that it makes financial sense. They need to know it's easy to use. It's got to be simple. It's got to be intuitive. The healthcare industry has been hit just like every other industry in terms of supply of employees,
Yeah.
especially at that admin layer, right? So they can't encumber their administrative staff with more tasks, and they need to know that this thing is very intuitive for the providers. To your point, you got 15 minutes in and
Yeah.
out, you got a lot going on, right?
Yeah.
So it's got to be really intuitive. And the last one is they need to know, what do they do if they identify someone who's outside of their skill set. So we always engage with primary care with a behavioral health partner in mind that they can do referrals to. So when I look at challenges, those in the primary care world, I think interestingly, when we first started out, technology was a challenge. Like the healthcare industry wasn't the most technologically adept industry. Amazingly, COVID has sped up the healthcare industry's learning, conferencing, video, online, remote access. So I'm not saying the healthcare industry is the most technical industry, but it definitely got educated fast
Yeah.
over the last 3 years, and that gap got bridged. The other big challenge is we have to prove the billing. There's a lot going on in healthcare, and they have to know that this is going to be reimbursed. It's going to be profitable for them to be able to spend the effort because there's a lot of other options going on, and that's specific to healthcare. I think, when I look at a challenge in the corporate world, right? The challenge in the corporate world is they're scared of identifying how many people need help, right? So they're just, okay, if you did first responders, a large percentage of them they're going to have a lot of anxiety, a lot of stress and stuff. Okay, well, we can't just give everybody time off. So you have to go in and speak with them, Kevin, not only with, hey, let's identify people, let's also stratify them, but with partners who can help address the issue along the way. To maybe summarize that a little bit, we need to just check the boxes that people know that this is efficient, that it's cost effective and actually could be profitable, and that we as a technology partner, we're not just a technology partner, we're also bringing a strategy there where we're bringing solutions along with us because we know they're going to identify people who need help. We know a fifth of the workforce is going to need help. We know a fifth of the patients need help. We know a lot of people are depressed. Here's an interesting stat for you. And this is across 60,000 data points just last year. 60,000 people took the PHQ-9, which is a very popular depression screen. 22% indicated moderately severe to severe, which is a score of 15 or higher out of 27. 60% who indicated high said they would like some help. 60%. So these are people know they're suffering. They want help.
Today, we have a special sponsored episode. I'm joined by Ernie Wallerstein, CEO of Mental Health Technologies, or MHT. MHT is a cloud-based platform that enables healthcare providers to identify patients that may be suffering from undiagnosed or inadequately treated mental health and substance abuse disorders. Find out more at mhtech.com. That's mhtech.com. Ernie, you've been at that crossroads of behavioral healthcare and technology for years now. Where do you see that intersection going moving forward?
So I actually believe the intersection is going to move forward, Kevin. It's a great question. I think the adoption of technology in healthcare, in corporate social governance programs is going to accelerate. We're all of the understanding now that this isn't something we can ignore. Luckily, we've had athletes, we've had superstars, we have people coming out and talking about mental health issues and not being ashamed of it, right? My generation, it wasn't something you talked about, but my kids, it's an open conversation. And because there's more awareness around it, I really believe the adoption of technology like MHT and the embracing of that technology is going to accelerate. And, so I think the horizon is bright and it's coming fast. This train has left the station. It is picking up a lot of momentum. And ultimately, there's not enough people to help the amount of people who need help, right? So we got to come up with some technological solutions. We have, some self-help solutions. And we have to come up with ways to help the healthcare industry actually address this. And then you get to the predictive models. So by gathering this information, right, and cross-referencing it with treatments, cross-referencing it with genomic information, cross-referencing it with demographic information, we can start getting ahead of this. We can start predicting mental health, substance abuse issues. Like you can take our software and once we have a million data points and we're well on our way there, we'll have that, within the next 12 months. You have enough data points to go to the city of LA and say, based on your current demographics and based on this million data points, there's a good chance you're going to have X, 150,000 depressed people in 2030. Get ready for it. And there's not more people going to med school right now. There's less people going to med school right now in terms of percentage of population because it's a very expensive proposition. And now there's a glass ceiling on how much money you make. It's a business. It's an economic issue. And who wants $300,000 of debt? So there has to be other, again, as I call them, off-ramps along the way. And technology like ours very much like ours, is going to allow us to start doing predictive models on what's required, what's coming, right? We can't predict COVID, the impact of COVID, right? But we could be way better prepared for COVID the next time it happens. And unfortunately, it'll happen again, right? And the 100-year storm will happen next year again, and all these things, like, the amount of stress and anxiety because of Hurricane Ian is off the charts, right? But starting building predictive models using AI and leveraging these data points, we'll be better prepared as a society to deal with this. And that's where I think this goes.
And my final question, what are some of your take-home messages that you want to leave with the Kevin MD audience?
There's a biased opinion. I think every healthcare professional is responsible for the mental wellness of their patients. I know it's an unfair statement because there's so much more going on. I'm in these doctors' offices all the time. There's not a lot of time to spare. People are around, and they're ultimately trying to help their people, help their patients. But I do think that mental health is now the number one issue in the world. It's, and COVID was bad, but mental health affects way more people than COVID did. And COVID was a horrible thing and it contributed to this, but this problem isn't going away. And I think that leveraging technology, knowing that it's not cost prohibitive, there's a financial benefit, the government gets it, the insurance industry is getting it, starting to get it, that a technology like this will help you identify the people that need your time and realize the people that are okay, so you can do this in an efficient fashion. I think we're all responsible for it. Ultimately, someone getting screened for behavioral health or substance abuse should be the same as taking their blood pressure. Blood pressure became a preventative measure because of the amount of people with cardiac issues, became too costly. We're on the same path when it comes to mental health, and we have to get preventative about it. So screening for behavioral health and substance abuse should be part of any preventative care philosophy program.
And how can people find out more about MHT?
Our website's quite good, actually. I'm really proud of our marketing director, Jen Salas, and our website's really informative. So it's www, which, like everyone, mhtech.com. And you can get in contact with us there. There's some videos on there, and there's lots of information about the company.
Ernie, thank you so much for sharing your time and insight. Thanks again for being on the show.
Thank you very much to you and your audience, Kevin. Thank you.